Morning team, my name is Shania Johnson and I'll be the RN for today.
And my name is Janine Pinedero. I'll be the LPN for today.
And my name is Frito Antoine. I'll be the UAP for today.
First, guys, I'd like to thank you both for being here to help take care of our patients. Now let's go over our patient assignment and prioritize some care. We'll have 3 patients for today. Patient 1 is a 28-year-old new admission with nephrolisis, an elevated temperature, and abnormal labs. They're alert and oriented, but the elevated temperature is concerning for potential infection. Patient 2 is a 21-year-old post-appendectomy on day 1. They're stable with no active bleeding and have a surgical dressing in place. Patient number 3 is a 34-year-old post-mastectomy patient. They're ready for discharge, but they need teaching on wound care and managing drainage. Patient 1 is going to be our top priority because of their elevated temperature and abnormal labs, which could indicate potential infection. Early identification and treatment are critical to preventing complications. So the first thing I'll do as the RN when going into that patient's room is to perform a thorough assessment, including checking their vitals, making sure to focus on their temperature, and also reviewing their lab results. I'll also ask about pain levels, urinary symptoms, and any other signs of potential infection. According to Hemi Gardner, vital signs may be elevated with pain, body temperature, and pulse are elevated with infection. And this is from year 2024, page 1424. Janine, as the LPN for this patient, I'd like you to administer any prescribed antibiotics or pain medications after I review the orders. Since this patient is alert, you can also provide medication education, like explaining the importance of completing the antibiotics effectively.
Got it, Shania. I'll administer the medications and make sure the patient understands the purpose of their treatment. As stated by Goglia et al. 2024, accuracy is needed with medication administration, a skill that involves rule-based habits and clinical reasoning. Page 320.
Thank you, Janine. Frito, as the UAP, please check and document this patient's vital signs as soon as possible and make sure to pay close attention to their temperature and report back to me if it remains elevated or if it increases.
Understood. I'll take their vitals right away and let you know if there's anything abnormal. Because as stated by Lynn et al. 2022, vital signs are an important element of clinical evaluation. Page 6.
Patient 2 is our next priority patient on the list. They're stable, but we need to monitor their recovery to prevent complications. The first thing I'll do when going into this patient's room is perform a focused assessment of their surgical site, making sure to check the dressing for any drainage or signs of infection. I'll also check their pain levels and make sure that they're comfortable. Janine, as the LPN for this patient, I'd like you to reinforce post-op instructions with the patient, such as how to position themselves in bed and when to call for help. Also check their dressings and let me know if there's any drainage or other signs of potential infection.
Will do. I'll check their surgical site and make sure they understand the recovery instructions.
Great, thank you, Janine. Frito, please assist the patient with ambulation to help prevent complications like blood clots or pneumonia. Also encourage them to get up and walk around as much as they're able and document how they tolerate it.
Got it. I'll help them ambulate and let you know if they have any difficulty. As stated by Ignatius et al. 2024, encouraging early ambulation reduces the risk for pulmonary complications and increases circulation to extremities. Page 186.
Okay, patient number 3 is our last patient for the day. They're the most stable and they're ready for discharge. The first thing I'll do when going into this patient's room is to assess their understanding of wound care and drainage management. I'll provide detailed discharge teaching and answer any questions they have about their post-op care. Janine, as the LPN for this patient, there aren't any tasks for you to complete with this patient, but as discharge teaching and education fall within my role as the RN. According to Painter, a delegating nurse must elevate outcomes and maintain accountability for the delegated activity, year 2024, page 258. In addition, the RN can't delegate any activity that requires the nursing process. That includes assessment, diagnosis, outcome identifications, planning, implementation, coordination of care, health teaching, and health promotion, and also evaluation. And this is from NCSBN and the ANA 2019.
Understood. Let me know if you need any assistance.
Thanks, Janine. Frito, could you assist this patient with packing their belongings and also getting ready to leave? Also help them to their car when their ride arrives.
Of course. I'll make sure they're ready to go and comfortable.
Perfect. Let's make sure we communicate throughout this shift, especially about patient 1, who's our highest priority. Janine, let me know if you notice anything unusual during your assessments or medication administration. Frito, please be sure to report any abnormal vitals or patient concerns to me immediately. Let's check back in after I finish my assessment of patient 1 to also ensure that we're on track. Does anyone have any questions before we get started?
No questions here. I'll get started with the meds for patient 1.
I'm good too. I'll grab patient 1's vitals first.
Okay, guys, great. Let's have a productive shift and work together to provide excellent patient care. Thank you, guys.